Good morning, everybody. Good morning. This event is a collaboration between Dr. Jonathan Trent and GIST Support International, often known as GSI. GSI is known to many of us, but to those not familiar with it, it's a patient advocate group for the support and education of patients and their families with gastrointestinal stromal tumour, or GIST for short. GSI is the largest organisation of its kind worldwide for GIST patients, and it's unusual in that it is entirely composed of volunteers, has no regular source of income, and is not a fundraising organisation. In that respect, it is truly grassroots. As you all know, until recently, GIST has been a poorly understood disease, being highly unpredictable and pretty untreatable once it became metastatic. I'd just like to remark how lucky we are that so many gifted people chose to devote their professional careers to a branch of medicine that can hardly have been enticing. They chose an obscure and little understood branch of cancers, or sarcomas I should say, untreatable by conventional chemotherapy, which often carried a dire prognosis. It is down to the courage of these physicians that the breakthroughs in treatment eventually came, and the future for GIST patients is now looking so very much brighter. Our speakers today must in fact have chosen to specialise in GIST before imatinib came along to revolutionise their hopes of having effective treatment options. We're grateful that they were prescient enough to choose to devote their professional lives to GIST. We're very fortunate that we have renowned experts on GIST who have agreed to come and speak to us today, including two internationally recognised oncologists, Dr. Trent and Dr. George. Dr. Pistos, who's a surgeon and expert in GIST surgery and on the international task force, Dr. Choi, who is renowned for her insights into the radiology of GIST, and Pat Neal, known to many of us as the sarcoma department oncology nurse at MD Anderson, who's expert in managing side effects of the therapies. We're also very fortunate to have such a very large turnout from all over the country. This is a great opportunity for us all to get together, and it's a pleasure to get to meet you all. We hope you will enjoy the day and meet many people you can share experiences with and learn a lot from the talks. Finally, we'd be very grateful if you would take time to complete the survey in your delegate pack and return it to us at the end of the day. It is really important we get feedback so we can improve this event for another time, and our sponsors would also like to know that, in your opinion, their money was well spent. Now, if you haven't already signed up for a lab tour, please could you see Henry Trent, who is circulating with a list. Now, Dr. Trent needs little introduction from me, but he is an Associate Professor of Medicine at the Sarcoma Centre of MD Anderson Cancer Centre. His clinical translational laboratory activities revolve around caring for GIST patients while developing new therapies and understanding the biology of GIST. However, his enthusiasm for helping patients has led him to speak at many similar patient gatherings to today's. Indeed, it was when I asked him to address a small group of us, he responded he would not only do that, but ask his colleagues to come and speak too. Then this event became today's major gathering. So it's all down to Dr. Trent. So I ask you to welcome Dr. Trent, who will be opening proceedings today with a talk on new therapies for GIST.
Well, thank you for the kind introduction, Barbara. And Barbara's giving me a lot more credit than I deserve. Barbara has really been the driving force behind this whole meeting, so I think everybody in the room should offer a hand of applause to Barbara. And so Barbara asked me to speak to a small group of people back, I guess, in the summer, and I'd done it before, and I thought maybe I should have some backup. I didn't want to be the only one having rapid fire questions sent to them, because it's the questions that you guys ask are the difficult questions, and it takes a lot of thought and a lot of expertise. And when you guys ask me surgical questions, I have to talk to my surgery colleagues because they're experts at that aspect of GIST. And when the question is a radiographic question, I have to talk to my radiology experts like Hasan Choi. because this is her. She devotes a large portion of her career to radiology of GI stromal tumor. And when patients have side effects, I spend a lot of time dealing with that. But honestly, Pat Neal and the other nurses are the individuals that are there in the trenches day to day helping you guys. And Pat has a real keen insight, and we work together very closely on problems that pop up related to the disease or the side effect of the drugs. And we learn a lot from each other, and it's a real multidisciplinary effort involving many, many people in the care of an individual GIST patient. So when Barbara talked about doing this summit, I thought it was a great idea, and I wanted to involve other people, because if somebody is going to travel 300 or 400 miles and spend a full day of their time just meeting with us about this disease, then they really deserve, I think, other opinions than just mine, and other disciplines than mine, because there are certainly, it's a very complicated disease, and it's multidisciplinary. So we started putting that together, and the number of people started growing, and so Barbara said, well, I think we have over 50 people now, so we may have to change the venue from her condominium. So we ended up moving it here, and many people have helped out with it. So it's been a lot of work, and I thought it was a good opportunity to discuss clinical aspects of GI stromal tumor. We have national meetings that we go to where the GIST experts show mouse models, and they show Western blots, and they show DNA sequencing and argue and discuss the fine points about that. And there are other patient meetings I've gone to where laboratory experts show their latest breakthroughs in terms of the molecular mechanisms of what causes GIST and how imatinib works. But there's not really a great venue just really to discuss specifically the clinical issues involved with GIST and the clinical and translational research specific to GIST. So that was kind of what I had in mind when Barbara asked me to help arrange some speakers. So I thought it nice to get somebody like myself who sees a lot of GIST patients to discuss a little bit of an overview and how clinical trials work and the purpose of clinical trials and what some of the options are that are out there. And to have you guys have an opportunity to meet and discuss some of the thought leaders in the field and the other disciplines of clinical patient care and clinical research, like Hae-Sun Choi, who has completely redefined the way that us medical oncologists assess response to new therapies like imatinib and sunitinib. And Peter Pisters, who is a surgeon who operates on GIST patients every week and is on all of the expert panels as far as surgical approaches, and is an excellent surgeon. And of course, we were lucky enough to bring in Suzanne George to discuss plasma level testing specifically, and that's a very hot topic right now, somewhat controversial. And I think that there's a lot of interest in patients in understanding it and seeing how that field is moving forward. And Suzanne is certainly one of the thought leaders in leading the charge and determining the utility of plasma level testing in patients. And of course, discussing side effects of drugs and with the disease, Pat Neal is going to help out. So I'll just begin by discussing a little bit about the background of GI stromal tumor. I suspect most people that are here have probably read reams and reams of paper and scoured the internet and know a great deal about GI stromal tumor. In fact, most patients I see know more about GI stromal tumor than the medical oncologists that they see in the community. But bear with me, I'm just going to go over a few things briefly. So GIST is rare, and there's only about 5,000 cases a year in the United States. In terms of GI malignancies, if a patient develops a mass in their abdomen, there's only a 0.2% chance that it is a GIST.